New York is at a 3.08% positivity rate. Governor Phil Murphy in New Jersey just signed an executive order extending the public health emergency. So the big question so many of you were asking, is there relief in sight? This morning we're going straight to the source, joined now by the director of the Centers for Disease Control and Prevention, Dr. Robert Redfield. Doctor, I know you're very busy. Thank you for making the time for us here in New York.
Thanks for having me.
So, Doctor, let's begin with the obvious. Thanksgiving just a few days away. Sunday was the biggest travel day in the airports with over 1 million travelers, the highest since the start of the pandemic. So let's begin with do's and don'ts. What are you advising?
Well, we really do want the American public to reconsider traveling during this holiday season. The safest thing they can do really is to stay home. At this point in the pandemic, the real threat for infection is not so much the public square, but rather these small household gatherings where people that don't actually live in the household join as family gatherings. And that's where we're seeing the silent transmission. Obviously, if you do travel, we think it's really important to wear a mask. Masks do work, to social distance, to be careful about how you put yourself in crowds. Obviously, be vigorous with your hand hygiene. But, you know, we have put out our guidance really recommending people strongly reconsider whether or not they really want to travel during this holiday season.
I wanted people to hear that from you. We've been urging it over and over again.
Not taken that advice, but I do encourage them at least to wear the mask, social distance the best they can.
Yeah, this Thanksgiving, as we've said over and over again, it's not going to be like any other Thanksgiving. And to see next year's, do what you're saying. There's a lot of discussion, sir, about lockdowns, right? The impact of it. One official says lockdown, another one says don't lock down. Do you think it's necessary to lock things down altogether for a few weeks to stop the spread? No.
I think it's important to be very strategic in how you use restrictions. Obviously, in the spring, we didn't know much about this virus. We were kind of confronting a relatively unknown enemy. Now we know a lot about this virus. We know how it spreads. We know mask work. We know indoor, non-ventilated, crowded situations where people aren't wearing masks are really a setup for transmission. So, as you know, certain businesses, I think you should give serious consider about shutting them down or limiting. For example, bars that are indoor, that are overcrowded, where people are drinking, taking their mask off. I think that there's wisdom in limiting that environment. On the other hand, when we look at, say, schools, K through 12s, we've opened them safely and responsibly. We've seen very little intra-school transmission, either for teachers or for students. And we really do thank the teachers that have the courage to help us.
So let me ask you this. When you look at New York City, right? New York City shut down city schools at this 3% threshold. Many parents were saying raise that threshold, open schools back up since transmission, like you said, inside is so little. Your thoughts on New York City closing schools down?
Well, each of these have to be individual jurisdictions' decisions. I've asked people to make these decisions based on data, not emotion. I assume arrangement made with the teachers or the teachers' unions on these decisions. We don't see the necessity in closing schools based on the prevalence of positive testing. We have schools that are effectively open safely in what we would call the red zone. We have schools that are, safe in orange zones, yellow zones. So I think it's an independent decision, but my own personal opinion is the best and safest public health thing for K through 12s is to keep our schools open for face-to-face learning.
And listening to you very carefully, talking about what you knew in the springtime versus what you know now, and why you actually aren't calling for a lockdown now, I want to get to this rumor that there's this different mutation of the virus, right? That we're seeing more cases, but we're seeing less fatalities. Is the virus changing as we evolve?
Well, the virus did change in the late spring in what we call one amino acid sequence. And that change, one of the things it is associated with is the virus replicates easier. So it gets higher levels of virus because of that amino acid change. And that could contribute to greater infectivity. We don't have any definitive evidence that the virus has changed in a way, though, that's altered pathogenicity and whether it causes disease or it doesn't cause disease. But we have some evidence that the virus did change back in the spring with one amino acid from coming from Europe, that virus replicates better and may contribute to the reality that this is a highly infectious virus, maybe more infectious than the original introduction from China into the West Coast.
Running out of time here, and a few more questions I want to get to. So big news out of Pfizer, Moderna, now AstraZeneca, right? These vaccines, 90% effective. When do you expect this to be rolled out? And for everyone at home asking, when do you anticipate that every person in the country could be vaccinated?
Yeah, this is really important to see this vaccine rolled out. You know, as I say, normally it takes 4 to 6 years to roll out a vaccine. We have 2 rolled out within a year. It really is a great historical accomplishment. I anticipate that the EUAs will be granted by the FDA somewhere between the 2nd and 3rd week of December. We anticipate Operation Warp Speed to have about 40 million doses available through them before the end of the year. That would be enough to immunize about 20 million people. Mm-hmm. And then in January, we anticipate another, say, 35, 40 million doses, and then it will continue to escalate. I think a majority of the high-risk individuals will get vaccinated by March. The majority of the American public will get vaccine, as I've said before, at the end of the second quarter, beginning of the third quarter of 2021.
That's good information there, but what do we know about the vaccine? You know there's going to be people who say, I don't want it, there's side effects, right? Is it 1, 2 shots, and do we have any information about side effects? You know, you get the flu shot, sometimes you say, I feel like I have the flu.
So this vaccine is going to be, both of these vaccines that will be approved by EUA in December that I anticipate will be a 2-shot vaccine, one separated by 21 days, one separated by 28 days. There are additional vaccines in development, one of which will be a 1-shot vaccine, but it's still in development. It is really important. I mean, what's been accomplished here is historic, and it's all for naught if the American public doesn't take the vaccine. We've been working very hard on this idea of vaccination with confidence. These are going to clearly be safe and efficacious vaccines. You mentioned there will be side effects. That will be very transparently shown when the safety data is complete by the FDA. A lot of these side effects are limited to sore arm or flu-like symptoms for, you know, less than a 24-hour day period. But these vaccines can be life-saving.
Of course.
In terms of preventing individuals from getting COVID. And even if you yourself is not at risk for a significant bad outcome, you may transmit it to one of your loved ones or neighbors that are. So I'm hoping the American public sees this vaccine for what it is and embraces it with confidence.
Yeah, I mean, I think that's information that we need to know about those 2 shots, right? If it is a 2-shot process, you're relying on those individuals to actually come back for that second shot to get the full effect here. I want to talk to you about the transition process, and we'll leave it on this topic. Have you spoken to President-elect Biden about the transition and about this vaccine rollout, plus what your thoughts are on coronavirus?
We have, you know, a very transparent about our work that we're doing. We're able to share it, as you know. We haven't been directly contacted yet. The Department of HHS has been really coordinating our transition for the agencies within HHS. But we do anticipate to have significant interactions in the days ahead.
And with the new administration coming in, sir, do you want to stay in your post at the CDC?
Well, that's going to be up to the president-elect. You know, I'm appointed by the president, and it's going to be up to the president-elect. This has been a great honor to serve as the CDC director. I know I was a little saddened to think I may be stepping down when the epidemic was just getting worse and worse and worse and worse. I'm really heartened by the 2 vaccines that are coming and glad that we can begin the distribution process that we will be beginning in the probably second, third week of December and get that on track for the end of January. So those decisions are really those decisions of the president-elect.
So if he does ask, you do want to remain?
Well, it's an honor to serve in this capacity, sure has been.
Dr. Redfield, I appreciate all of your insight, the information about the vaccine. Next year is a big year for that vaccine rollout. Appreciate all of your insight, making time for us here in New York City this morning. Really important to hear your voice.
Yep, thank you very much.
Have a safe Thanksgiving to you.
Yeah, you too. God bless.